Today we're going to be discussing the kangaroo mother care and parental attachment in low birth weight infants. This is presented by Victoria Montoya Almanza, Janki Patel, Caitlin Rivera, and Taylor Wells. We're with the Brooks College of Health at the University of North Florida.
All right, so the significance of researching the kangaroo mother care intervention to clinical nursing practice is attributed to the role nurses play in implementing kangaroo mother care with mothers and their infants. So nurses play an important role in this intervention because they must follow suggested best practices for the sake of ideal patient outcomes by acting as an educator, an advocate, and a supporter. So according to the World Health Organization, each year around 1 in 7 infants are born with a low birth weight of less than 5 pounds, 8 ounces, and of the 2.5 million newborn infants who die each year, 80% of them are of low birth weight. So kangaroo mother care has been proven to improve infant vital signs, infant sleep, infant-parent bonding, and decrease the risk of infection. So, more notably, infant-parent bonding has proven to encourage positive emotional and physical development of the infant, which is something that we would desire most in low birth weight infants. Therefore, it is relevant in clinical nursing practice to understand these benefits and facilitate care that allows for the utilization of kangaroo mother care. So our clinical question, in low birth weight infants, how does kangaroo mother care immediately after birth compared to no kangaroo mother care affect infant-parent bonding within the first 6 months of life, should then guide nursing practice in the timely implementation of kangaroo mother care while also bringing attention to the significance of doing so through the analysis of low birth weight infant-parent bonding. So now to our evidence-based practice model. So the Johns Hopkins evidence-based practice model influenced our research process by helping us identify a question regarding the use of kangaroo mother care, improvements that can be made to the implementation of kangaroo mother care, and how that can be translated into real-life practice. So from here, we were able to identify areas of practice, research, and education that are applicable to kangaroo mother care. So using this model, we could also analyze internal and external factors that could affect the implementation of kangaroo mother care. So factors like these could include access, availability of resources, and cultural factors.
For our research, we used a plethora of different methods to find articles that were applicable to our topic. The databases that we used were CINAHL, Cochrane, Medline, and PubMed. The keywords that we included in our research were kangaroo mother care, skin-to-skin, infant-parent bonding, and low birth weight infants. Our inclusion criteria was the English language and peer-reviewed articles. After researching, our search results concluded that we had 40 studies that were identified in our search. And after duplicates were removed and the studies were assessed for their eligibility per our inclusion and exclusion criteria, 5 studies remained for our analysis. 2 were quasi-experimental studies. 1 was a systematic review meta-analysis study. We had 1 randomized control trial and 1 exploratory study.
In one of our findings, which was a systematic review, that one found evidence and outcomes of kangaroo mother care with being associated in a reduction in infant mortality rate, severe infection and sepsis, and hyperthermia, and it did show an increase in weight gain and breastfeeding. In one of our primary researches, that result stated that early kangaroo mother care increased maternal fetal bonding, which is what we were looking for in our main PICO question. And then one of our clinical practice guidelines, we found that it mainly spoke about the effects and impacts of kangaroo mother care, what infants are the right candidates for receiving kangaroo mother care, which are pretty much all newborns, including preterm babies, which what we were specifically looking in our PICO question. Who can perform the kangaroo mother care in positions that are the most beneficial for the parent and baby, and that it also provides any kangaroo mother care associated risks that parents may have any concerns about. So after all of our research, we did find that kangaroo mother care should be initiated in healthcare facilities as soon as newborns are clinically stable. Barriers and facilitators that we found was lack of compliance, of people just not doing the exact amount of time needed for kangaroo mother care to be effective. Another barrier was knowledge deficit, that there's just not much education going around, and any cultural boundaries that really don't allow people to do that, or they just don't really agree with it. And then our study showed that there are beneficial aspects for adhering to kangaroo mother care, but majority of our studies did not specifically mention the benefits of bonding, which we stated in our PICO question, mainly except for our primary research result.
To conclude our research, evidence established in the findings are in favor of supporting the implementation of kangaroo mother care. Any interventions with kangaroo mother care that leads to increased infant-parent bonding is clinically significant. The effectiveness of this practice is dependent on its application of it. The implementation of kangaroo mother care is important for the reduction of complications with infants and improving their clinical outcomes. The infant-parent bonding is achievable with education initiatives made by healthcare providers and the adherence of the practice made by the caregivers of the infant. The promotion of this application requires a joint effort with the staff, hospital, and with the help of the correct supplies and equipments. Thank you for listening.